Welcome back to Alberta Live. I'm your host, Walter Schwabe. I'm here with PC leadership candidate Doug Horner. So, Doug, let's switch gears to healthcare. Okay. Tell me, the government of Alberta's got this 5-year health action plan, but can you help us understand why we needed an orthopedic surgery center?
Why do we need an orthopedic? Well, we need a lot more than just we need a lot more than just an orthopedic center. We need to change the way we do healthcare. We need to change the way we access healthcare. I mean, why is it, well, in today's age, why is it that your doctor can't send you an email that says, well, test results are back, things are good, stay on the medication, you don't have to come in and see me? Why is it that we don't have nurses in high schools and in junior highs and K-12 so that we actually can get in front of some of these issues before they turn into something that we have to spend a lot more time on? Why is it that, when you're trying to get your prescription renewed, and you know how you're doing, you know your system, you know your condition, that you have to wait for 2 hours in a waiting room to see the doctor when the pharmacist could probably do what you need him to do? Our problem is not so much after you get through the gate, it's getting through the gate. And if we can change those access rules, if we can change how we access healthcare to the appropriate healthcare professional, now you start to open up those other issues. Orthopedic centers, why don't, we have cancer care clinics, we have all sorts of specialized care clinics, but it's having that access that we have to change.
So I bring up the OSC, as it's known as short in this case, because I'm not sure if it's fixed the whole hip and knee surgery issue, the backlog there. And the reason why I can speak to this directly is because my stepdad has been needing hip surgery for, it seems like, forever.
Right.
Can barely walk.
How many times was you referred?
Well, that's the thing is I don't know specifically how many times, but but it just seems like he's bouncing around. Yeah. And so we've got this sort of shiny new facility was supposed to increase the amount of surgeries happening, but we just can't seem to quite get the right formula going here. We keep throwing money at it.
Well, we've got the funding agreement now. My point is that we have enough money in the system today. What we need to do is change the structure of the system. Because remember, when this system was created, my dad was a doctor. When this system was created, my father started a family clinic in Barrhead. He owned the building, he owned all the supplies, he hired the nurses. That's a private business. When the federal government nationalized healthcare, they didn't come in and buy his business. They said, we're going to create an economic climate that will sustain your business. We haven't changed that structure since the 60s.
Right.
But medical technology, surgeries, day surgeries, all of those sorts of things have changed dramatically. The training that we do, the scope of practice for a registered nurse is now 70% of the scope of practice of a family physician. But we don't use her to that, or him, to that degree.
Right.
We need to change the structure of how we do healthcare. That's why we announced our healthcare policy yesterday.
Okay, so
on hornerforalberta.ca, by the way.
Picking up on that, okay, talking about your new healthcare policy.
Fabulous.
And I know you've been talking lots about it in the last few hours and throughout today. Let's talk about, you suggested earlier in the show, right, talking about allowing physicians to use the internet and those kinds of things to start delivering care. Okay. Yep. Is this in any way going to open up the door further to private healthcare? And how will, by the way, if I get access to healthcare through a registered nurse, how does the billing cycle work on that?
Well, and perfectly good questions, because there's a distinction between private delivery and private funding. There's been a suggestion that we could somehow solve our wait times if we introduced private funding, or create some economic opportunity if we introduced privately funded, privately delivered. I think we're going down the wrong road there, because we've got so much work to do on the publicly funded. Whether it's privately delivered or publicly delivered is not the issue. It's the publicly funded system. Let's start working on that. That means you open up the access. That means you add technology. That means you now have to get management information. And you're a business person. You have to have management information on the costs if you're going to be able to pay that nurse on a fee-for-service basis. Well, that means that every client's going to have an access card. And once that access card is utilized, the system then has the management information it needs to manage the system. Today, we don't even have that. So why are we talking about all those other things when we should be actually working on fixing the system we have?
Okay, so in other words, you're not necessarily saying that you're not for privatized healthcare, but you're saying that you want to fix the public system first.
Absolutely. If you try to do both things at the same time, you dilute one. And you actually get into this debate, which we've been in for a long, long time, which actually stops you from accomplishing anything. What I said today on another interview show, I said, what we're talking about is doing this in steps. You have to do this in steps. You have to bring all the stakeholders along with you as you move through those steps. And what people will see is you move through those steps, you're actually accomplishing something. Well, let's do that for a change instead of talking about whether we want to go privately funded or publicly funded. That's not the point. Albertans want publicly funded health care, so let's deliver it better.
Well, Gary Marr certainly found that out recently in terms of mentioning his advocating of privatized health care. He took some hits there. So if he was to come back and let's just say, for example, in a really weird and wacky world, okay, you don't win, and Gary does, and he becomes premier, you're in cabinet, and he proposes a bill that is going to bring back the third way concept. Is that something you vote for?
I'd argue in cabinet and in caucus, the way I'm arguing today, that if we go down that road, we're not going to get anything done. And the reality is the economic opportunity in healthcare is not privately funded delivery being sold in the province. The economic opportunity in healthcare is commercializing the tremendous amount of health research that we're doing in this province. The Alberta Heritage Fund for Medical Research, some say that, some actually think that we got rid of it. We didn't get rid of it. It's there. We should actually double the size of it. What we did was we focused it through the Alberta Health Sciences Solutions Corp, using Jacques, who was the CEO of the Heritage Fund for Medical Research Board before, is now the CEO of the Health Solutions Corp. Let's develop a system that actually takes the medical imaging we're doing at University of Calgary and turn it into a commercial business enterprise right here in Alberta. Let's take the virology research that we're doing at the University of Alberta. Let's create some vaccines and start a pharmaceutical industry here in our province. That's the economic opportunity that will actually create a tax base that will help us fund healthcare in the future. And by the way, why we have all of these high technology industries coming to Alberta, we also then have access to some of the best, most technologically advanced healthcare in the world. That's what Albertans should be looking for.
Well, I agree. They should be looking for that, and nearly demanding it, I think.
That's right.
In this province. Okay, now let's talk seniors, because aging demographic. This is no surprise to anybody, right? Okay, so why are we not better prepared for the coming tsunami of folks who are retiring? In terms of extended care and the facilities that we're sorely lacking in the province. What's your plan for that?
One of the things that I've heard crisscrossing the province 3 or 4 times, Albertans do want change. And the change that they're looking for is a change in the way we make decisions. We have been making decisions based on dollars and dogma for 15 years because we felt we had to do that to get the financial house in order. Today, we are sitting in the strongest financial position of any jurisdiction in the Western Hemisphere, maybe even more than that. It's time that we started talking about building Alberta. It's time we started talking about leveraging our balance sheet. It's time we started talking about actually making decisions based on the value proposition, not just the dollar. I'm a business person. I have 20 years of international trade in over 20 countries around the world. I've built facilities. I've built plants. You use your balance sheet to your advantage and you get your dollars to work for you. If we start working in collaboration with municipalities and some of the not-for-profits and some of the other care providers and help them actually build these facilities sooner, now, when we need them, and actually put care on top of that, in other words, have the seniors stay where we build the facility for them, you don't separate couples, and you start adding health facilities or health services to where they are, I think seniors will be a lot better served in that kind of system than in waiting for the cash to accumulate in the cookie jar.
Okay. Well, ladies and gentlemen, we're going to take another short break, and when we get back, we're going to talk crime and punishment. We'll be right back with Doug Horner.